My name is Abdrazak. I'm a fourth year medical student. In today's video, we shall be discussing about diabetes mellitus. So what is diabetes mellitus? In simple terms, it's a multi-system disease of abnormal metabolic state which is characterized by hyperglycemia due to inadequate insulin production. We have said it is a multi-system disease, meaning the effects will be affecting multiple of our body system, and secondly, it is a metabolic. Here we have an abnormal metabolic state with hyperglycemia. Hyperglycemia is abnormal glucose in our blood, and it may be due to insulin production deficiency. So in our overview, with diabetes mellitus, patients cannot control the level of glucose in their blood. And basically, there are two types of diabetes. There is type 1 and type 2. So what is it with type 1? In type 1, there is lack of control of glucose due to absence of insulin production. Here, there is insufficient insulin coming from our beta isolates of Langerhans, while for the type 2 mostly it comes due to an insulin resistance. Type 2, it's when our tissues are not really responding to the insulin produced. In diabetes mellitus, we say there is chronically elevated levels of glucose in blood, and that can lead to many complications, as we shall see. So what is epidemiology? So what is the epidemiology of the disease? How is it distributed? Approximately 10% of the cases of diabetes, of course, it will be a type 1, while the other percentage will be taken by the type 2 diabetes mellitus. So in simple terms, diabetes type 2 is more common. It's kind of common than type 1. And the main pathogenesis of the diabetes type 1, it's mainly an autoimmune disorder, meaning your beta cells are being destroyed by the immune system, which will in turn lead to decreased insulin production, and is an association with HLA-DR3 and HLA-DR4. What are the clinical presentation of the diabetes type 1? So we shall call this the 3 P's. If you see them, then there are high chances that this patient could be having diabetes mellitus type 1. The first one is polyuria. Polyuria, what does it mean? That is this is due to hyperglycemia causing increased glucose in urine, and as a result, a person will be passing out large volumes of urine. And the second clinical presentation is polydipsia, that is increased consumption of water. That's mainly because our thirst centers in the brain are really activated, and every time the patient has that urge of taking water. And the last P is polyphagia. Patients will be trying as much as possible to consume a lot of food. Why? Our cells are not getting enough glucose. Insulin is insufficient, although there is hyperglycemia, but the glucose is not able to enter into our cells. So that's why we find polyphagia coming into play. Patients will be consuming more quantities of food. So approximately 25% of patients with diabetes type 1 initially present with what we call diabetic ketoacidosis. In simple terms, we shall be calling it as DKA. That's diabetic ketoacidosis. So what is diabetic ketoacidosis? How do we diagnose it? If we get any of the 3, there are high chances that these patients could be having DKA. The first one, hyperglycemia. That's when the glucose levels in blood is above 250 milligrams per deciliter. Then That's one of the criteria we can say someone has DKA. Second is ketosis. Uh, Ketosis is the second, and the third is metabolic acidosis with an iron gap. An iron gap. Those are the three classical things we can take in the diagnosis of DKA. So what is the pathogenesis of DKA? Basically, it's characterized by a combination of insulin deficiency and relative glucagon excess. So there is insulin deficiency, and similarly there is excess of glucagon in our system. So the physiologic stress such as infection contributes to the development of DKA by increasing catecholamine release. There is release of these catecholamines, which in turn increases the physiologic insulin requirement. The catecholamines are released, which in turn increase the physiologic insulin requirements. The second is a decreased peripheral glucose uptake. In the peripheral, glucose is not really taken into cells, and it's not well utilized. Why? There is insufficiency of insulin, and the excess glucagon will in turn lead to more of the hyperglycemic state. In turn, due to insulin deficiency and we are having glucagon excess, the insulin sensitive lipases are activated, which results in hepatic mobilization of the free fatty acids, and later the fatty acids will be converted into the ketone bodies. That's why we find ketosis being as one of the presentations of DKA. The pathogenesis, we have talked more of this. So what are the clinical presentations of DKA? The signs you'd look at, there is nausea, vomiting, there is thirst, there is abdominal pain, weakness, fatigue, many of that. And for the signs, we shall get tachycardia, poor skin turgor and warm, and dry skin. Patients also have ketones on breath, so they have that kind of sweet smell, their breath. The laboratory findings, of course, shall find high glucose levels in blood, that's hyperglycemia. We shall get an iron gap, metabolic acidosis, and serum ketones. So what we should know with these, the important points to note is, here patients feel really sick, they will present earlier than patients with hyperosmolar non-ketotic coma, which we shall see in a diabetic mellitus type 2. Thanks for listening.